Hi, Dr. Osborne here, and one of the things I want to talk about today is how patients with gluten sensitivity oftentimes fail to heal because of the medications that they're actually taking. There have been some research studies now that are ongoing and that are undergoing that are now looking at whether or not the gluten in certain medications are contributing to the persistence of disease and symptoms in patients with gluten sensitivity. So that's one of the arenas. So if you haven't checked your medications, if you're gluten sensitive and you're not responding to the diet, one of the first things that you want to do is check your medications with your pharmacist. And make sure, don't ask whether or not the medication is gluten-free, because if the medication contains different kinds of corn glutens or rice flour protein extracts, etc., then they're going to tell you that it's wheat, barley, rye, and possibly oats-free, but they're not going to make mention of the corn-based ingredients that are oftentimes hidden within medications. So again, I encourage you to get with your pharmacist to get that information so that if you are reacting to those corn glutens, you can get them out of your medication and start feeling better. One of the other consequences, though, to being on medications for long periods of time are nutritionally related. Many medications, commonly prescribed medications, actually cause vitamin and mineral deficiencies. And so long-term use, for example, long-term use of blood pressure medications can reduce vitamin B, as well as CoQ10, and can affect magnesium and potassium and other very vital nutrients necessary to sustain normal function of your body. As a matter of fact, it's such a great problem. There have been a few medical textbooks written on the topic. One of them is actually called Drug-Induced Nutritional Deficiencies, and this particular book was written by a pharmacist and his group, and they set out to identify all the peer-reviewed medical literature on how different medications can cause vitamin and mineral deficiencies. So if you've been on medications for longer than 6 months, you're on a gluten-free diet, you're not healing, one of the things you want to make sure you investigate, aside from the potential for the cross-contamination or hidden gluten in your medicine, is the side effect of drug-induced nutritional deficiencies. Because if your drug or your medication is causing a vitamin C deficiency or a magnesium deficiency, then it's going to slow down the healing process and prevent you from getting better. So at any rate, I hope that's helpful information for you. That's all for today, and we'll see you next time. Have a great afternoon.